born on Christmas Day, myself.
It is. Good afternoon, everyone. My name is Christy Matheson, and I'll be the moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Good afternoon, everyone. Today we're reporting 3 new cases of COVID-19. 2 of the new cases are in Central and 1 of the new cases in Western Zone. All 3 are travel-related and are isolating as required. Our vaccine program continues to roll out, and today we have administered over 23,000 doses and over 8,000 people are fully vaccinated. Last week we told you that the federal government redirected a percentage of the Moderna vaccine from every province to go to the north, to our isolated Indigenous communities. They can only use Moderna, and this was not our province alone, it was every province, and every province agreed with the directive. This week, we expect to receive over 10,000 doses of Pfizer vaccine, and public health will be spread across the province, setting up clinics in Antigonish, the South Shore, and Cumberland. We are already in Halifax, Truro, Kentville, and Cape Breton. Our frontline healthcare workers will continue to receive shots, as well as our long-term care residents. It may feel like a slow process, but we are now able to administer the vaccine in all parts of our province, and as more supply comes in, we will be agile and ready. I want to thank Public Health, the Nova Scotia Health Authority, and all volunteers, including those who have come out of retirement to help us with the vaccine rollout. Thank you. And I also want to thank all of you for your patience. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. As the Premier mentioned, we are reporting 3 new cases of COVID-19 today, all related to travel outside of Atlantic Canada. 2 of those are international, and 1 is domestic travel. This is not our norm, as we haven't seen numbers above 2 since January, and I'm thankful for that. However, it is a reminder of the vulnerable position that Nova Scotia is in. All we need to do is look at our neighbors in Newfoundland. We must stay the course and continue our cautious and vigilant approach to preventing the spread of COVID-19 in Nova Scotia. Last week, 2 cases we reported were additional cases of the UK variant of COVID-19. To determine both a source for the infections and whether the cases themselves had resulted in further spread of the variant strain, we conducted a detailed reinvestigation, tested over 150 people who could have either exposed 1 or both of the cases themselves, plus we retested the 32 close contacts of the 2 cases. To date, all test results have come back negative, which is really good news. So although we're still waiting for a small number of results from possible or people who could possibly be the original source, this is reassuring. We may not know the source of these variant cases at this time, but we have no indication of community spread, either as a source for these cases or resulting from the 2 cases. For this week's vaccine update, I'll begin with a recap of our overall vaccine supply. So since December 15th, we've received 36,750 doses of COVID-19 vaccine. This includes the 1,950 doses of Pfizer vaccine delivered late last week. With this, we've been able to administer 23,134 doses to date. 8,221 Nova Scotians have received their second dose and can be now considered fully immune. The remaining vaccine will be delivered during the coming week or has been held as a second dose for individuals already vaccinated with an initial dose. More data on supply and doses is available on our data website and dashboard on our coronavirus government website. This week, we expect to receive 10,530 doses of Pfizer vaccine, half of which will be reserved for second doses. This will be our biggest single shipment of vaccine to date. It will be delivered to 7 cold storage sites across the province. And this number of doses does take into account that we will now be drawing 6 rather than 5 doses per vial of the Pfizer vaccine. We have 4 healthcare worker clinics running this week in Halifax, Truro, Kentville, and Cape Breton, and the final 3 healthcare worker clinics will be set up and ready to receive product later this week in Antigonish, along the South Shore, and in Cumberland. Vaccine was delivered to 8 long-term care facilities last week, and 2 more will receive vaccine this week. In long-term care, we have clinics running in multiple locations this week. Booking opened up this morning for the prototype immunization clinic at the IWK for Nova Scotians who are 80 years of age or older. It's important to note that those receiving an invitation to book an appointment are being selected randomly by their postal code, and these are the postal codes which are within an hour distance of the clinic site. And this clinic will run for 4 days starting February 22nd. Booking opened today, and there's been a lot of interest, so much so that the first 2 days are almost fully booked already. So if you have received a letter to participate in this clinic and are able to attend, I'd like to remind you that the invitation is only intended for the person who received the letter. It cannot be transferred or extended to another individual. You will need to book your first and second appointment at the same time, and your second appointment will be 21 days after your first dose of vaccine. You can bring one support person to assist you on the day of your appointment. That individual, however, is not eligible to receive the vaccine. Most people are able to get the vaccine. However, if you've had a serious allergic reaction to any of the ingredients in the vaccine or have an autoimmune or immune system problem, you should speak to your family doctor, nurse practitioner, or pharmacist before you book your vaccine appointment. The IWK has taken measures to ensure there is enough parking for people on the clinic days. I know there was a question about this on Friday. In addition to the IWK Parkade, we have secured street parking adjacent to the IWK on University Avenue. They have reserved free spaces in front of the children's part of the IWK. They've increased the number of accessible parking spots within the parkade. The vaccine appointments are staggered to reduce the number of people that will be requiring to be on site at any one time. And there will be IWK staff and volunteers both inside and outside the clinic building to help direct people parking and entering the building. So we continue to work towards our prototype clinics for pharmacies and in our First Nations communities, which we mentioned last week. And as we develop more details, we'll provide those at future briefings. As the Premier said, over the weekend, we received a number of follow-up questions around the federal government's reallocation of some of Canada's Moderna supply to the Yukon, Northwest Territories, and Nunavut. I want to reiterate that this was a decision of our federal government to address the complex and unique challenges in our northern territories. We understand the rationale and appreciate that we need to come together as a nation to address these unique needs of our northern neighbors. Our approach to vaccine in Nova Scotia has and will continue to be strategic, flexible, and adaptable to either increases or decreases in vaccine supply. That's a key principle on which we're basing all our planning. We will update you as we learn more about what to expect for our March Moderna shipment in the coming weeks in relation to this reallotment. We are continuously examining our testing strategy around the province. It has and continues to be a key component of our overall COVID response. And to support that, this weekend coming up, we will have pop-up testing available in St. Peter's on Friday and Port Hawkesbury on Saturday. And you can certainly find more details about this on the NSHA website. Just look under coronavirus testing. We've also been hearing a lot from people who are 70 years of age and older who want to do their part against COVID-19 with asymptomatic testing. And they're anxious to say, there are a lot of questions about, well, how often should they get tested? So like all other age groups, the advice that I can give that if you have more than one single consistent social bubble or family bubble of 10, please consider adding regular testing to your COVID-19 prevention measures. And the greater the number of people you have in close contact with through either work or social activities, the greater your risk and the more important and frequent regular testing should be. However, if you're only going out once a week to get things like groceries and you're following all the COVID protocols, you're very safe and you may not need regular testing. However, like everyone, you should continue to wash your hands, maintain a safe physical distance, wear your mask, stay home if you're feeling unwell, keeping your social circles small, and follow all the requirements of the public health order. In closing, I want to say that I want to share a message that I heard earlier today. Somebody had alerted me to it. It was on the CBC radio program, The Current, and the Quebec astronaut David Saint-Jacques, who has recently returned to the medical field and is now working in a COVID unit in Montreal. And he shared a message that really resonated with me. He said that people, because he was asked about how it felt to be in a place where he's helping save lives. And he said the people that are saving the most lives are the people in communities who are following public health orders and protocols. When you wash your hands, wear your mask, or even getting an asymptomatic test, you are making a difference. You are preventing the spread of COVID-19, and make no mistake about it, you are directly saving lives. Taking seemingly small COVID safety steps every day matters. It will keep your family, friends, community, and healthcare and other essential workers safe. So I would like to thank all Nova Scotians for all that everybody's been doing and continue to do. Together, Nova Scotians are making a huge difference. It's not high-tech, it's not complex, and it doesn't require a healthcare professional, but basic prevention works. And it's a lesson that we need to remember far beyond COVID. So I look forward to talking with you on Friday, Premier, our last briefing, and I wish all Nova Scotians staying safe today. It's not a good day out there, but stay safe and please keep looking after one another.
Thank you, Dr. Strang. And I think you said there was a pop-up clinic going to be in St. Peter's.
St. Peter's on Friday, and then in Port
I
Hawkesbury.
want to remind all of my cousins from down on Lower Lordways to make sure that you go in and have your test. And I want to tell everyone in the region, make sure you stop into the gas station, say hi to Georgie, and spend some of your money in the local economy.
Thank you, Premier. We'll take one question and one follow-up in the time that we have for today, starting with CTV's Sarah Plowman.
Hi, this is a question for Premier McNeil. We're hearing from the paramedics union here in Nova Scotia, as well as patients' families, serious concerns about ambulance shortages and delays in responding. What is the province doing to address these concerns and these gaps in service?
Well, there's been ongoing work for quite some time. We knew there were issues with offloading when ambulances would be bringing people into some of our facilities. They're having challenges of offloading the patients, so they get their rig back on the road. We knew when that happened there was a domino effect across the province. There was a number of steps put in place by Minister Delory when he was there. Obviously, the concern that I heard this weekend out of the Bass River area is certainly alarming, and I know that it is being looked into to see what happened in that particular case and what we can do to make sure that that service is there. Early on, we also know that part of the issue has been with COVID. Our firefighters who were out doing some of that emergency calls have been prevented from doing that. My understanding is now that that training is ongoing, and that part of that service will be back up and functioning.
Go ahead with your follow-up, Sarah.
Okay, so do you know when firefighters will be able to respond to these incidents, given that they can't currently?
It's my understanding that the training is started now. I know some of them receiving that training, and others have chosen not to, so it will vary. But it's my understanding that training is ongoing now. Do you know, Dr. Strang?
I know from talking with Dr. Travers, who's the medical director, just back in the first wave, that they were already working with emergency first responders, and we've certainly made, along with paramedics, we've made any of the emergency first responders who are part of the volunteer fire department eligible for vaccination, along with their paramedic colleagues.
First wave, yeah.
Next question will go to Keith Doucette with the Canadian Press.
Good afternoon. Dr. Strang, I'm wondering about the fact that the province has only issued about 60% of its allotted vaccine take to date. And given that you mentioned yourself the situation in Newfoundland, where in a period of about 2 weeks, because of the presence of the variant, they went, from like something like 6 cases to well over 200 cases very quickly. Has that given you pause, again, I think I've asked this before, but I'll ask you yet again, about the conservative approach we have to meeting out our vaccine? Might we be a little more aggressive, given that there's a chance that the variant could come back and we could see an explosion in cases at any point?
So no, I mean, two things. You got to remember, it's the vaccine or not is not an issue about explaining what happened in Newfoundland. The vaccine we have to add in. Doesn't solve everything right away. The vaccine is just one more part of our overall COVID response. And until we get assurances of a reliable, ongoing supply of vaccine, we're in a position where our best approach is to make sure that we get people the 2 doses of vaccine as quickly as they can, because it's the 2 doses that we know there's the evidence of a reassurance of the best possible and the longest possible immunity. When you look at other provinces, they are stretched out and they're going for a single dose, but there's no assurances that at this point in time, we continue to look at the evidence that they're going to have ongoing immunity from that single dose. There's also, we talk with, as I said previously, we talk with our clinical colleagues, some of our immunologists, et cetera. They have significant concerns that if you have a partially immune population with lots of people with a single dose, they don't have full protection, and then you have a surge of virus and a lot of circulating virus, you're actually setting yourself up to produce more variant strains because of the virus circulating within somebody's body when they're only partially immune. So we continue to look at that. I was involved in conversations on Sunday with my colleagues nationally, but we're in a fortunate position in Nova Scotia that we can focus on getting our target, which is getting as many people as possible to the 2 doses of vaccine, withholding the second dose and focusing on the 2 doses as our target.
Go ahead with your follow-up, Keith.
So again, barring information that would tell you that 1 dose would be sufficient, as an interim measure, is there anything that would make you change your mind in terms of, the need that you see to get those vaccinations out maybe a bit quicker?
No, I mean, as you said, unless our epidemiology changes substantively, or there is good, solid evidence around that that would give us much more comfort that a single dose of vaccine gives you a good enough and sustained level of immunity.
Next question will go to Elizabeth McSheffrey with Global.
Hi there. My first question is for Premier McNeil. I'm wondering if you can just share your reaction to the court decision today that will require the management fee for the ferry to be released, and whether you feel the province should appeal that.
Well, it's actually it's with Bay Ferries. It's not the province. Bay Ferries is the one that would have been in court. So the company is looking and reviewing what are its options. But it definitely tells you and sends a signal to the private sector what the Progressive Conservative Party of Nova Scotia, led by Tim Houston, believes in proprietary information. He wants to be able to dig into every private sector company that has business with the government of Nova Scotia, even if it puts them at risk. And I just don't agree with that. But the company will have to make its own decision.
Go ahead with your follow-up, Elizabeth.
Thank you. My next question is for Dr. Strang. You mentioned our approach to vaccine in Nova Scotia is continuing to be strategic and flexible, adaptable to increases or decreases in vaccine supply. I'm wondering if you can elaborate on, what the contingency planning looks like if we find ourselves in a position where we're not getting the vaccine doses that we're expecting regularly. Will we be able to sort of quote unquote catch up quickly, or will it just sort of be like, well, this is as fast as it can go, and if we have to miss our September targets, then we do?
So, we have to adjust to the vaccine we have available. And if things slow down, we'll have to ramp down our vaccine delivery, and then we would ramp it up as soon as possible when we get additional vaccine. If that pushed us off target, it would be unfortunate, but we can only do what we administer the amount of vaccine we have. However, I have to say that even though we've had some short-term delays at the start, we've got everything we're hearing is still we're being reassured that by the time we get to our 90 days, we will get the full allotment that we were expecting to get in the first 90 days, and we're still fully expecting to get substantively greater amounts of vaccine once we move into the second and subsequent phases of the vaccine program. Enough so that our target is to be delivering 12,000 doses of vaccine a day once we get robustly into the second phase of our vaccine program.
Next question will go to Jean Laroche with CBC.
My question is for Premier McNeil, and loath as I am to correct you, Premier, you are a respondent to the Department of Transportation and Public and Infrastructure Renewal is a respondent in the case that my colleague Elizabeth just noted. So you actually do have a decision to make as to whether or not to appeal. So I go back to her question. Will you appeal, and if so, why?
As I said, the company that is looking at it said today they would be having their legal team look at it. And then the new government will have to make a decision, the new premier. But I want to make sure that you communicate to your listeners that every penny that has been spent on the Yarmouth Ferry has actually been accounted for. What we're talking about is proprietary information of a company. Where I disagree vehemently with Mr. Houston and apparently you is that you should not be able to dig in and put a company at a disadvantage. And I believe that's what this does. So the company will have a look at it, and the new government will have to make its own decision. But I can tell you very strongly, we worked very hard to drive economic growth in this province to create jobs. More young people are living in and working here, and that we partnered with the private sector. And in my view, this sends the wrong signal. It puts a chill over private sector investment in this province. And if that's what the Conservative government wants to run on the next election, good luck.
Go ahead with your follow-up, Jean.
Premier, not to be argumentative, but I wasn't posing any sort of value judgment on the case, only suggesting that the province is a respondent in the case. That was my only point. Dr. Strang,
if I can, Jean, my point would be, you know that there will be new premier sworn in the coming days. They will make a decision based on that. But you should also know, because it's actually being communicated in the media, that the company has already laid out the fact they're having their lawyers look at this case. But I think it's very clear, and since this may be the last time for you and I to communicate about this issue or any issue, I think it would be factual if you said all the money that's been spent on the Yarmouth Ferry has been accounted for at every step of the way. This is really an attack on proprietary information in the private sector. That's all I'm pointing out to you. This is not a decision for us to make, for me to make. It will be made by future government, but the company. But it purely is an attack on proprietary information in the private sector, and I believe it will put a chill on private sector investment in the province of Nova Scotia. And if that's what the Conservative Party stands for, they should stand up and say so.
Jean, do you have a follow-up on COVID?
I did. Dr. Strang, you talked about the variants and the explanation that you gave about how it's not in the community, and even though you can't really determine how these people got it. I just wondered, how is it that in Newfoundland their variant has caused an explosion of cases, and here in Nova Scotia it has not? Is there any way to explain that?
No, I mean, I think I don't have a full explanation, and we're fortunate. Other than if people were following, we have to assume that the majority of people who were potentially exposed were following all the public health measures that did not allow large, spread between people. And so if we're fortunate and that's the case, it's a demonstration of how this multi-layered approach, a range of different public health protocols, cells, even if the virus is present, can make a big difference. But we'll continue to look. But I just wanted to give the update to people and give them the very reassuring news that despite extensive retesting of known close contacts and going back and testing a large number of people who the cases themselves would have been exposed to at the right time to be explained where they could have got their infection from, has not revealed any source. Which to me is all very important work to do and very reassuring that we're not missing something, undetected circulation of the variant strain. I can't fully explain it, but I think, again, to me it points out the importance of everybody continuing to do all these public health measures, because even if you do have the virus, they all are very important and can greatly impact the ability of the virus to spread.
Next question will go to Nabal Sna with the Herald.
Good afternoon. Dr. Strang, you mentioned last week that the federal government is looking into getting the sequencing for variants to happen outside Winnipeg and other provinces. So I was wondering if it's a possibility that Nova Scotia would be doing that and what logistics that would require.
So we're actively looking at that. I can't, there's nothing in detail to bring forward, but we're actively looking at that possibility, and we're looking at opportunities with federal resources that might be able to help us make the investments necessary to do that type of whole genome testing here in our Halifax lab. And we're also very interested in how we might be able to do this in partnership with Prince Edward Island and New Brunswick as well.
Go ahead with your follow-up, Nabal.
Thank you. Dr. Strang, you've mentioned before that you were in conversation with the African Nova Scotian and the Indigenous communities about the vaccine, and I've also seen the COVID-19 explained videos on social media about the vaccines as well. But I was wondering if the province has detailed approach to address any hesitancy that people might have and what that will look like.
So that is a key reason that we're working very closely with our First Nations communities as well as the African Nova Scotian communities. One is to work with them to say what were the details of where and when and how we actually deliver vaccine. But another key part of this is how do we use their knowledge and their leadership within their own communities to best provide information that helps people understand the importance of getting the COVID vaccine, how it's safe and effective in their cultural context, and overcome some of the barriers, the long-standing barriers around mistrust of the health system and other pieces that we know have been talked about as potentially contributing to COVID vaccine hesitancy. Giving the communities as much ownership and leadership and space to help guide our communication is critically important as we engage these communities.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Hi there. Question for Dr. Strang. I'm wondering what the progress is like on developing a plan to use the Pfizer vaccine in long-term care homes.
So I haven't got an update on that today. We're still looking at part of it is we're waiting to see how much, what is the confirmation of what reduction of Moderna vaccine we'll get in our March delivery. Where it depends. If the people I talked to today said we may not get much of a reduction in the March Moderna vaccine, which then means if that comes out to be true, then we may not have to turn to using the Pfizer vaccine, which is much more problematic in delivering that and storing it for long-term care facilities.
Go ahead with your follow-up, Lindsay.
Thank you for that. And I'm wondering, too, going forward, it seems clear that identifying variant cases of COVID will be critical. I'm wondering what's necessary to be able to make that identification in Nova Scotia instead of sending it to the national lab.
So I'm not a lab person in detail, but essentially what it means to do the identification, you have to be able to do the test that can actually provide information on the whole genome of the virus, and you compare that. Does the genome match up with a number of different strains? what would be required is to get the right type of equipment and the training in our lab here at the QE2 Health Sciences Center, led by Dr. Hatchett, to actually do that whole genome sequencing testing in-house. If you wanted to get more details on what exactly that would take, I would recommend that you request to have a conversation with Dr. Hatchett directly.
Next question will go to Tim Biscay with the Halifax Examiner.
Good afternoon. Lindsay just asked my question about genetic testing, so I'll move on. Dr. Strang, you had at our last briefing, I think, what sounded to some people like a change in policy for people self-isolating. You said that they could go out and walk or run and have exercise outside for an hour. Was that a change in policy? And if so, what brought that about?
So that was really a clarification, because we've allowed that along in our work with our university students, and we wanted to make it clear for everybody else. And it's really a recognition that having somebody undergo a 14-day quarantine can have a significant impact on their mental and physical health. The importance of people being outside, being able to be active, but being able to do that in a way that doesn't put them in a position where they're exposing other people. And with the right protocols, you can do that. So we were just bringing that forward to make it clear that was a possibility if people were willing to follow the appropriate protocols for anybody under the provincially mandated 14-day quarantine.
Go ahead with your follow-up, Tim.
Well, as I say, Lindsay asked my question, so I'll just leave it there. Thank you.
Next question will go to Victoria Walton with The Coast.
Thanks. This is a question for Dr. Strang. You said there's been really high uptake on those first IWK clinics for the 85-plus age group. And I know at the last press conference you said you sent out, extra invites to that clinic in case some people don't sign up. Are you reassessing whether you're going to continue to send out excess in the future because of such a high uptake?
That's our team. The vaccine planning team will be looking at that. I think we always want to err on the last thing we want to do is have unused spots in a vaccine clinic, because that means we potentially have wasted vaccine. So I think anytime we do this, we're going to be looking to, these one-off time-limited clinics. We'd always look to invite more people than we absolutely need. I recognize that may end up putting some people in a place where they can't get their appointment, but it's far better to have a bit of that disappointment knowing that they will be able to get their vaccine over time than to us waste vaccine by not having slots filled in any of these prototype clinics as we develop them. Once we get into large, ongoing, sustained vaccine supply, this becomes a non-issue, really.
Go ahead with your follow-up, Victoria.
Thanks for that. And I just wanted to clarify, I think I heard Dr. Strang mention offhand that this coming Friday would be Premier McNeil's last conference as Premier. Is that true? Will we have Premier Rankin by this time next week?
He will announce when his swearing in is. I don't know when that is at this point, but Friday, I will be here on Friday, very proudly, sitting beside Dr. Strang as I have now. For 11 months, I think people are getting used to having us around.
They are. I may have misspoken. Whoever shows up with me at the briefing, I'm happy to be with them.
Well, the only question will be: will you be the tallest one at the podium?
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Chrissy. Today we reported 3 new cases, and that may not seem like a lot, but it's more than we've had in a while, and it's proof that COVID is still here. COVID is in every one of the zones in our province. Maybe it's 1 case or 2, but COVID is still here. Those that test positive are all isolating, and we are grateful for that. But one slip, 1 day of complacency can turn a good day into a very bad day. Look at our neighbors in Newfoundland. That was a province that was free of COVID for so long, and in a matter of days, their active cases climbed exponentially. I don't want to target any one individual province, and I don't want to sound alarmist, but anyone that thinks COVID can't find a way in isn't thinking at all. So let's stay ahead of COVID, continue to take the virus and the variants seriously. Let's remain vigilant, even though we are tired. We have to stay strong, even though we feel fed up, and we have to stay apart, even though we want to be together. The vaccine is rolling out, and our time to be together will be soon. But right now, we have to continue to do what we're doing, follow the protocols, and support one another. See you Friday.